We'll be concentrating now in our schools. It's been a week since most of our children went back into the classroom after almost 10 months of closure. But this is still in the midst of COVID-19. How have they fared as a parent? How has it been for you? Taking them and bringing them back, or watching them go and returning? How has it been? We'll love to hear from you. But let's have a conversation with Mr. Kofi Asare, Executive Director, Africa Education Watch. And your outfit, Mr. Kofi Asare. First of all, let me say good morning to you. Thank you so much for your time. There you are.
Hi, good morning, and good morning to your cherished audience.
Great. You issued a statement, coinciding with the International Day of Education, where you make some recommendations. We'll come to that. But having monitored the first week since our children went back to school, at least most of them, because some parents still insist that they don't think that it is safe for them to send their children back to school. How has the first week been?
Well, we begin by indicating that it was right at the time of deciding to reopen school to think of same, because the kids have been at home for about 10 months and the learning loss was becoming too much. At the same time, the virus was within acceptable limits. Unfortunately, just when school reopening was announced, we started experiencing an increment in the spread. And ever since, it's been up and up and up. We're doing about 80 cases at the time school reopening was announced, and we are now doing about 650 to 670 cases a day. And so, yes, it was good to reopen schools, but the sudden change in the behavior of the virus, coupled with the poor planning and implementation of the reopening process, has raised, and created in the need for concern and the mixed feelings that we are all experiencing today.
Did the monitoring also reveal how schools are dealing with either adherence? There was reports last week of one school at least that recorded some 2 cases.
Well, our monitoring in week 1 indicated that there was no regard for physical distancing, absolutely no regard for social distancing, suggesting that the GES is either indecisive or has decided to ignore the physical distancing regulations of the WHO, UNESCO, and of the government of Ghana. The minimum class size we saw in Greater Accra was about 65 in public schools. There were class sizes up to 80 and 90 in areas like Kaswa, in areas like Nyenyano, in areas like Ashaman. Class sizes are 3 times more than the recommended number in most cases. And so, not the impression, but then the evidence on the ground suggests that the GES is indecisive on whether to conform to the social distancing requirements of the health authorities or not. It also suggests that wearing of nose masks is now becoming a substitute for physical distancing. And so that is what we saw. Apart from that, we saw schools that initially did not have vertical buckets. Most schools had just 1 in the center of the school. The maximum were 3, with 2 normally not functioning. But the GES indicated that by the end of the week, all schools were going to receive their PPEs. Let me indicate that as an agency in charge of managing tertiary education, we had a lot of confidence in the GES's ability to manage the reopening process because of what it did prior to this, which was the piloted reopening last year. Unfortunately, we are disappointed that we are making mistakes even where we had things right, last year. Because for the GES to come out and say that, well, just because the PPE is delayed could not mean that we should delay reopening of schools, and that just 1 week is okay for us to delay with our PPEs and now we're going to supply them. That statement alone is suggestive of the fact that the hallmark of GES, is not the perfectionist one that we thought we were all working with. When it comes to health and safety, you have to be perfect because there is no room for lapses in matters of life and death. Unfortunately, it's been business as usual, and that is the disappointing part. Apart from that, the positive aspect is that we've seen a teaching force that is committed to weather the storm, and manage teaching within the pandemic at the risk of their lives. And we've seen an enthusiastic learner population yearning to come back to school and reconnect with their teachers to continue the business of teaching and learning, which has been truncated for about 10 months now. So that is what we observed in the first week of reopening.
Mr. Sam, we know that the GES gave general guidelines. Is it up to them to do the physical distancing for the schools? Don't the school authorities themselves have a certain responsibility here?
Well, the GES is the service delivery agency. So they are the one we hold responsible for lapses in implementation. The GES's own guidelines failed to put a cap on the number of students per class. In the 2020 guidelines, which was used successfully, the GES had a cap of 30 per class. This time around, it removed that cap from its guidelines for reasons known to GES themselves. So now we are having a situation where we get the impression that teachers are not ready to split the classes, because if they split the classes, they will likely end up running a shift system, and teachers will have to teach from morning till afternoon. I mean, from 7:30 to 4:30, which they are reluctant to do without any extra compensation or motivation. And so, because on the other side, the guidelines is not restrictive of the class size, teachers seem to be comfortable managing the numbers. But the issue is not about what is comfortable or what is manageable, within a status quo. The issue is about what is manageable within the confines of the law. Because the president has actually affirmed that this social distancing, physical distancing requirement must be deployed and enforced throughout the whole country. And so one has no discretion over them. And that is why, even beyond the executive endorsing it or its legislative backing, we are concerned that it borders on compromising, health and safety. And so we think that the removal of that cap is one of the reasons why we have high class sizes, with schools not being too eager to split them into manageable classes and then run the shift system, just because they don't want to work from 7:30 to 4:30.
I have the Finder newspaper, and on page 4, there's a school that is running the shift system. Thank God, because there are 80 children in one class. At least after going through the first week, they decided, and this is in this is Breman Esikuma districts in the Central Region, where the Sikuma Catholic Girls School headmaster has been telling the Finder that there was a meeting. District directors, teachers, all agreed that the school was overpopulated. So they decided to run the shift system. My question is, maybe the first week schools couldn't decide that, but going forward, that is something that could happen.
Of course, they have no option, because we are making noise all over the place. They have no option because we are making noise all over the place that the wrong thing is being done. So the pressure being put on the GES will definitely push them to succumb. But our concern is that this meeting between head teachers and district directors should have taken place 2 weeks before reopening. Immediately the president announced the reopening of schools, school heads should have been asked to meet their district directors to do the permutations over class sizes, because every school head, every district director has the class size list for every school under their jurisdiction. We are talking of a maximum of about 100 schools per district, average of about 90 schools per district. So directors being asked to meet all school heads and do the permutations for splitting of classes should have been so fundamental. This is so basic, it should have happened at least 2 weeks before reopening. Then a week before reopening, for instance, school heads should have been asked to come and feed the district directors with data on whether they were going to run shift system or they had extra teachers to be able to run parallel systems where perhaps a class would be split, with one class taking place in the church and the other remaining in the classroom running simultaneously. This is what has been going on in other countries. And so we were surprised, or we are still surprised, that we are having this discussion today. This should have been done before reopening. As I keep saying, compromising on health and safety for a minute has its own ramifications. There is no excuse for COVID, has no time for piloting. It has no moratorium. and it has no time for laxity in planning. And so the least mistake you do, you put someone's life at risk. And that is why we are actually unamused about the approach that the GS has adopted. With this discussion you are talking about, this meeting of heads should have taken place 2 weeks before reopening. And so the planning process was very, very, very poor, and we are very, very much disappointed in them. That notwithstanding, we are happy that they are beginning to realize that you cannot run classes with people more than 50, not even 40. We need to conform strictly to government's own physical distancing protocols, because as we speak, we are now doing 670 cases a day. When we're
doing more. We're doing more, and whilst you're talking, we're just going to put the Ghana Health Service data there. I've got a question on that. There are people who are saying that we were not here, we were not recording these figures when the president announced. But now that we're here and our active cases are more than 3,000 now, as you can see, 3,286, should we be talking shutdown again?
Well, we have no option than to start talking shutdown. There is no option. Let me give you an example. In July, when schools reopened, for the pilots, the rate of infection was about half of this. It was about 1,005 in July when we were reopening. Okay, as we speak, last week, 3 countries have shut down their capitals. Kigali is shut down. Lilongwe, Malawi is shut down. Freetown is shut down. Schools in Kigali shut down. Schools in Malawi is shut down. Okay? And these are countries that are reporting between 100 and 150 a day. We are doing 679. We've been doing 600 back on the 19th and on the 20th. And we've experienced a week-long reopening, which was beset with overcrowding in our classrooms. We don't know the implications of that lack of, observance of health and safety protocols to the families that these children will go and then mingle with when they leave school. And so, since we have proven, over time in the past week that it is conforming with physical distancing requirements of the health authorities is more or less, if I should put it this way, it is more or less thermodynamics. It's so difficult. Then the only option we have is to shut down, because if we continue this irresponsible approach to policy implementation this way, we are going to put all of us, our lives at risk, and we are going to die. So yes, we need to discuss shutting down, because the Ghana Education Service has proven beyond doubt that it has no clue how to plan the reopening of the entire educational system within a pandemic like COVID. We have just let our guards down, and we've messed up in week 1, and we are afraid that given the increasing numbers of new cases, discussion on shutdown is never off the table. It's actually on the table.
But let's, put this in a certain perspective. We've been careless in most instances, no social distancing, no adherence to the protocols. But the fact still remains that schools haven't been that affected in terms of it is too early, just as you said, for us to determine the kind of implications our carelessness would cause to our students and the schools. So why do we come to this conclusion of let's discuss shutdown?
Well, I'm talking about discussing shutdown of Accra, not schools necessarily, of Accra. Shutdown because the rate at which the virus is spreading on a daily basis is almost twice what we experienced in July. It's more than what occasioned initial shutdowns. And if we look at other countries around us who have lesser numbers, obviously shutting down is an option. Let me give you an example. In Sierra Leone, for instance, they shut down Freetown. The shutdown they are implementing there is simply that no citizen is allowed to travel outside Freetown and go out of Freetown, because the disease is situated mainly in Freetown. So they don't want it to spread so much to the outside parts of Freetown. So there are various types of shutdowns that you can implement. Some you will not allow anyone to move out of the epicenter, and some you will not allow anyone to also enter or leave the epicenter and go internationally and all that. And so it depends. But then, given the rate at which we are increasing our spread, shutdown is actually one of the options on the table. Now, go to the school. If you study how the disease is spreading in other countries, including Ghana, you may be making a big mistake if you are expecting to hear cases in schools before you conclude that the lack of conformity to health and safety protocols in schools is affecting the community spread. This is why I have heard of testimonies of cases of patients, even on networks on multimedia, where someone was infected because they took their child to a swimming pool, a child who was about 6 or 7 years, took them to a swimming pool, and then the next day they had mild cold, and then that was it. The child would just have a mild cold, and that was it. But you are going to be infected, and yours is not going to be mild cold. And so if you are waiting to see high temperatures and all the symptoms exhibiting in a child because they got exposed to the virus in school or around the school environment due to lack of observance of the protocols, that may not be the case. You may end up seeing families being infected, okay, because their children were exposed to the virus. So that the symptoms will manifest rather at the family level and not necessarily, in children who are maybe in the lower primary or that. So let's have that at the back of our mind when we are discussing the spread. So whenever we are seeing increases in the community spread, we shouldn't rule out the fact that the increases are as a result of communal factors, including out of school and in school factors. Of course, we've seen teachers in other schools, we've seen students and a teacher in the school in our airport. We've had cases in one other school reported amongst the elderly. But one may not know how they came into contact with this. If it was through a contact with a child, you are not likely to see the same symptoms in that child. And so that is what makes it even more worrying in our case.
Great. Shutting down Accra would also mean shutting down schools, obviously. We have very enthusiastic children. My own children have been looking forward to going back to school. They've been excited, waking up at 3 a.m., 4 a.m., ready to go back to school. And it's not just me. There are other parents who are also sharing similar stories. How do we continue with the education if we have to close down again?
Well, when it comes to education, health comes definitely before education. Many schools have closed down in the first week. There are a lot of schools that are working online. Most of the elite schools actually refused to reopen because of the community spread that was occasioned by day one of school reopening. And so most of the private schools are running virtual schools. If you go to East Lagos, most of the schools, Cornerstone, if you come to Ivy Preparatory, there are so many schools are running online because of the fear of contracting the virus, because the virus is increasing. And so in the midst of this, that's why I'm saying that we have demonstrated at the public level that we cannot manage the schools within the COVID because the GNAS is not ready. It's not prepared to enforce government-owned guidelines. That is why we are discussing the closure of schools. It is because the entity responsible for managing schools within the pandemic has proven in the first week that it hasn't got the capacity to do so. So why should you put the lives of parents at risk, if not children? Why should you put the lives of parents at risk? If the parents die, who will take care of their children? And so let's elevate the discussion beyond school and look at the health of the families that the children will go to every day and say that if government, through the Ghana Education Service, cannot manage simple physical distancing in our classes. I'm just coming from OEB Presby right now, this morning, and they are there, 8 in a class. And then the DRO will come and sit on radio TV and then be talking about, be saying B and C when the situation is A, and we are talking about health and safety, for God's sake. And so if we obviously want to do PR with health and safety and we cannot manifest compliance on the ground, then there's no point in reopening schools to endanger the lives of children and parents. Mm-hmm. That is why we should be discussing, we should, as part of our discussions, be considering, among others, shutting down if the non-compliance continues. That is why the president said that, do not give me a reason to shut down schools again, because he reckons that there might be a reason to do so. Other than that, he wouldn't have stated that. And we are giving him the reasons, because basic compliance with physical distancing protocols, supplying of PPEs ahead of school reopening, these fundamental things have suddenly become very, very difficult for the Ghana Education Service to manage.
Mr. Sari, stay with me for a while longer. I want us to check this adherence to the protocols. Let's go to the University of Ghana. My colleague Kweku Asante is standing by. Kweku, tell us what you've been observing. Hello, Kweku Asante, if you can hear me.
I'm currently live here at the University of Ghana. Just behind me is the very famed BAM Library, touted as the biggest library in this part of the continent. And so today on campus, we are checking how much students on campus are adhering to the COVID protocols, how well they are ensuring that they are safe and all. And a number of people have raised concerns that since universities reopened, students have not paid so much attention to the protocols. And so there have been calls that the universities must do more. And since I've been on campus this morning, I've observed quite a healthy adherence to the protocols because, as we know, the University of Ghana, even though they've resumed, they are not having in-person classes. They are doing online. And so most of the students are having their instructions online. And so let me speak to a few of the students who are here at the Bound Library waiting for the library to open so that they go in there. A number of people have already gathered here, and then we take their views, and then we will also check from the halls of residents. Hello, sir. Please, what's your... Yeah, okay, you're on Zoom. Okay, let me start with you. Please, what's your name?
My name is Bilal.
Bilal.
Yeah.
So Bilal, what level are you?
1100.
1100.
Yeah.
So, I mean, are you a resident or you are a non-resident?
I'm a non-resident. Yeah.
Right. So that means you come from the house every day. I mean, to come for your online lectures, to come and use the school ICT facilities. How well do you think yourself, your colleagues, and management is doing in terms of the COVID-19 protocol, the wearing of masks, social distancing, and all?
As you can see, people are wearing the masks. But today they say we are starting the face-to-face lecture, so we have come to check.
What course do you do?
Economics, geography, and history.
And the idea was that you're going to do online classes. Are you now doing in-person classes?
Yeah, we are doing online, but today we are starting the face-to-face. Yeah.
All right. So Bilal here telling me about online classes that they do. Today they are beginning the in-person classes, face-to-face. And so let me speak to this lady as well. Hello.
Hi.
Please, what's your name?
Geraldine Amankweje.
Geraldine, okay.
Yeah.
Geraldine, so just like I asked your colleague, how well do you think we are all doing, your colleagues? Are you a resident, for instance? Which hall are you? J. Nelson, okay. So if you look at the hall, how well do you think people are doing in terms of adhering to the COVID-19 protocols?
Okay, it has been good because you can't enter without it. The protest will send you back to enter. Even if you are carrying something, they will help you get the thing down for you to wear your mask before.
Right. Yeah. And so, I mean, online instructions and all, how well has it been going for you in the midst of this COVID?
All of them, most of them I would say has been great because the lectures meet us up and we write the necessary notes and the reading material. But we have little challenges with the number of students that are supposed to be present. That's the only challenge that we are having.
Right. So Geraldine here telling me about the kind of challenges they've had so far in terms of the online in the midst of COVID. The University of Ghana has migrated part of its instructions online because of coronavirus fears and the idea that they want to limit the spread. And so let me go to the other side of the library. A number of people have also just been sitting there waiting for the library to officially open. They will go in there, use the ICT facilities of the university to be able to take their courses. So let me come here. Hello. Hello, good morning. Please, can we speak to you for a brief moment? Please, what's your name?
I'm Edith.
Edith, so you're live on JoyNews. I mean, in terms of COVID adherence, so far, how well do you think the school has been doing, yourself with your colleagues and all?
Oh, the school has been doing well with the washing distance. It's been good.
Right. Are you a resident?
Yeah.
Which hall are you?
Mensa Saba.
Mensa Saba hall.
Yeah.
So, in there, together with your roommates and all those things, do you think that you are safe, you are protected in terms of...
Very safe, yeah.
Right. So let me go here. Please, what's your name?
Hannah.
Hannah. Are you also a resident?
Yes,
Saba
please.
Hall?
Yes, please.
Okay, Mensa Saba Hall, the Vikings. So, I mean, do you feel safe in terms of going about your academic duties?
Yeah, every place in the school, anywhere that you go, they have this Veronica buckets and then water. They have the thermometer and then everything. So before you enter, you check before you enter inside.
Hello. Please, are you also in Men's Saba Hall? Right. What, are you roommates or you have friends?
Yeah, friends.
Roommates plus a friend. Okay. So, is it that you feel confident that you'll be able to go about your duties or your academic instructions without catching COVID, or you feel like there's more to be done on campus so that students feel safe?
Please, yes, I'm more.
You feel good about all that's going on,
yes.
right? So, I mean, most of the University of Ghana students that I've spoken with here at the BAM Library have expressed a great deal of confidence in the mechanisms that the university have put in place to be able to protect them. So far, we've not had a lot of complaints from campus. I mean, 2 weeks ago when I came here, this Monday, when level 100s were reporting, there were a few of such situations where people were not adhering to the COVID protocols, they were flouting the rules, they were not wearing their masks. But we spoke to the Dean of Student Affairs, Professor Alufa Bobkin, who gave us assurances that they are going to do enough to be able to ensure that these protocols are adhered to. Of course, the University of Ghana has an isolation center. It has the University of Ghana Medical Center, which has been like the cream de la cream for the VIP people who have COVID. And so they also have the University of Ghana Hospital, where they have an isolation center to be able to deal with this. So far, we've not had any complaints or any reports that there are people who have been put in these isolation centers or people who are suspected to have contracted the coronavirus. And like I told you earlier, the University of Ghana has migrated its course of instructions online. And so with the exception of a few students like nursing and other courses where they must necessarily meet in person, most of the instructions are done online. And so it has limited to a certain extent the risk of spreading the virus. But one other issue that have come up is that the rooms are still fully populated. So if you go to the diaspora halls, there are still 4 in a room. If you go to the traditional halls, there are still 3 in a room. Or if you go to the annexes of the traditional halls, there are still 4 in a room. And so these are concerns that some have shared, that if you are doing online and you are still populating the halls, people are going to share the same bathroom, the same washrooms, then you'll probably be spreading be increasing the risk of catching COVID. Let me speak to a few more people, Mama V, before we come back to you and you take it up in studio. Hello, sir. Please, what's your name? You're live on JoyNews.
Right.
Right, are you a freshman?
Yes.
What hall are you, please?
I'm not at
You're not on campus. Okay. So that means you commute to and from the house every morning before you come to be able to go about all this. I'm asking, that means as a non-resident, you come from the house every day to be able to go through your academics. Taking public transport and coming here, how safe do you think you are to be able to come to campus and do all the things you do?
I don't think I'm really much safe, but since my accommodation is not guaranteed on campus, so I'll be managing for now, but I'm still doing other things to be on campus.
Right. But when the university opened its portal, did you go through it?
As at the time they opened the residential application portal, I've paid, but it hasn't reflected in my system, so I couldn't get access to it.
Sure. So a non-resident also here, and a great deal of the people who are here are non-residents because they come here to be able to.
University of Ghana, Legon. I guess this is the picture that Kofi Asari would have loved if it was spread across, but unfortunately that's not the situation everywhere else. Let's quickly go to the Western region. Natalia Kwanzaa is standing by. Natalia, is it Market Circle you are?
Yes, Mama V.
Okay, so what's the picture? What can you tell us in terms of the adherence to the protocols, particularly also watching school children going to school this morning?
Well, Mama V, at the Market Circle this morning, as you can see from the backdrop, there is no social distancing being observed. A few of the traders in here have their face masks on, and some of them, with a few even have it on, most of them have it below their chin. Those coming in to buy are also not wearing their face masks, with most of them also having it below their chin. Coming to the Market Circle, I observed that the students going to school have their face masks on. even with children around 5 years that I saw this morning. And then when it comes to the market circle again, Mama V, they used to have water basins with soap, tissue, all scattered at the various entrances of the market circle. But this morning, going around the various entrances, I've seen that all these things are not there.
Okay, so we seem to be relaxing, even though we're recording a lot more cases these days. In Natalia, we'll leave it here. Thank you very much, in Natalia, joining us from the Western Region Market Circle, to be precise. Anas Abet is also in Techiman. Anas, good morning. Where exactly are you? What can you tell us? Hello, Anas, if you can hear me. Okay, I'm not sure we have Anas Abet, but let me quickly go back to Mr. Kofi Asari, who's with Education Watch. Let me come back to, first of all, I was just saying that the situation at the University of Ghana campus, that's something that you would have loved if that was the situation everywhere else. Unfortunately, that's not the story, but they are certainly doing something good that's working for them.
Yes, we think that the universities, some of the universities are actually approaching the reopening process with tact and some good planning, and must be commended for that. We appreciate that all the universities have challenges. I mean, all the institutions have challenges, not just public schools, but also public universities. They all have challenges. But then the difference in approach, and strategy for implementation obviously always makes a difference. That is not to say that there are no issues of overcrowding in the universities. We have information that at the University of Education, for instance, in the social science department, they are running classes around 1,000. The political science class, for instance, it's around 1,000, and so which is unacceptable. So
classroom.
It is not all the universities. Some of them are still running higher class sizes of 1,000 and all that, and we have decided to actually engage the Tertiary Education Commission on that, because not all universities are actually doing the blended learning. That is the blend of the virtual and then the in-person one as a strategy to reduce the class sizes. Not all of them. There are some huge numbers coming up from the University of Education which are not in conformity to the social distancing regulations of the Ghana government. And we want to raise that issue to the attention of the National Council for Tertiary Education, which is now called the Ghana Tertiary Education Commission.
I was just going to say that University of Education, Winneba, I remember in the early stages of COVID-19 when schools were doing online, they had a huge problem. They didn't even have a management system so that the student could do online. But 1,000 students in a class, that is definitely a no, and it shouldn't take any external observer to be prompting them of this issue.
Yeah, exactly. We know the university hasn't got any effective virtual learning system, but then they ended up admitting 20,000 students. So obviously we knew there would be congestion there. 20,000 students, we knew there would be congestion there. If you go to the UCC, where the UCC is the largest university in Ghana when it comes to admitting of students. It has close to about 65,000 students. Okay, if you go to the UCC, prior to this academic year, they had 67,000 students or so. If you go to the UCC, they are doing a lot of blended learning. So both the university and the colleges under the university are deploying blended learning approaches to reasonably, face lessons and split classes. We are not saying that at the University of Education, and we are worried. We are following the University of Education case carefully, but it is absolutely not. It is actually not an option, especially in the social sciences faculty where there are over 2,000 students. At the University of Education. We encourage all the universities to, as much as possible, adhere to the physical distancing requirements, because that is the only insurance that, should there be an outbreak, its effect will be minimized within the population. Okay, so immediately you begin to flout the physical distancing regulations, then you should be ready to see a spiraling, effect of a single case. But whenever you are observing, you are trying as much as possible to observe same, even if one person acquires the virus, you may realize that the impact, the multiplier effect wouldn't be so much, within the population. That is what is good about observing the physical distancing protocols of COVID. And so we have the tertiary institutions on our radar. At the end of this week, we'll be doing a report on both the pre-tertiary and the tertiary institutions in respect of their compliance to health and safety regulations within this COVID reopening period.
Great. Let me just go to Anas a bit, and I'll come back to you so we can wrap up on this. Anas a bit is in Sunyani or Techiman, I beg your pardon. Anas, good morning. Hopefully you can hear me. What can you report? Are people adhering to the protocols?
Good morning, I hope you can hear me from this place. This is the Techiman, the heart of Techiman, the Techiman Pharmacy Station, where I'm standing currently. And in fact, from what I'm seeing, a lot of the people here are actually complying to the COVID-19 protocols. I have seen quite a number of them already in their nose masks. Only a few of the people I see here are without their nose mask, and the credit goes to the security agencies over the past few days, from Thursday, Friday, Saturday, Sunday. They make sure they keep on monitoring the situation on the ground, and they've arrested quite a number of the people. And as a result, this morning I'm yet to see any of the police officers on the grounds, but almost all the people I'm coming across this morning are already in their nose mask for fear of being arrested later in the day when the police hit the ground. So from this area, you can see almost everyone around me are already on their nose mask. People are, complying to the protocols strictly so far as the use of the nose mask is concerned, Mama.
Okay, well, Anas, thank you very much. It's good to know that because the police are now arresting people, people are beginning to take it serious. But it saddens some of us because they're not wearing the mask because they know the effectiveness of the mask, but they are doing it only to prevent arrests. Interesting, but that's where we've got into. Anas Sabit there joining us with a live report from Techiman. Mr. Sarah, I want to play some young children. 1 week after going to school, they were on Kids Paradise, one of our shows on our sister station, and they've been sharing some thoughts. So here we go with some young children, 1 week of reopening amidst COVID-19.
Hi guys, I'm Benedicta. I school at the Grace Academy at Kumasi. I'm in JHS 3. I'm very happy for the reopening of schools. I thank the president for what he has done. As I'm going to school, all the safety protocols in our school has been observed. When you first enter the school, you have to wash your hands, wipe them clean, and put the tissue in the dustbin. After that, you go to the place and they'll check your temperature. So when you're done, then you move to class. Everybody is wearing his or her nose mask, and every student, every person in the school has his or her sanitizer. So in our school, we always wear the nose mask. Even if you remove it, you get punished. So when you are first entering our school, it says no mask, no entry. And I thank the president for opening the school. Thank you.
Hi, my name is Juanita Walden, and I am from Flowers Gay Schools, and I'm in P6. I'm super excited, and I want to thank the president for opening the schools for us so we can go to school, and you have to go to school so that we'll be educated so that we become great people in future. Thank you.
My name is Prince. I school at King's Palace. I'm in JHS 3. We adhere to all the protocols. So I pray God will continue to grant us more life so we can finish peacefully.
Okay, the fact though is that most of these children are in private schools, and the kind of systems that they put in place are totally different. So, Ms. Asari, just in wrapping up, I want us to go back to some of the recommendations that you give in the statement that you issued to mark International Day of Education. You're beginning to even talk about vaccines, but I want to remain at your paragraph 1, where you are calling on African government to prioritize the involvement of local communities, especially parent-teacher association, in planning and implementing their school reopening agendas, and more especially in finding additional spaces to use as classrooms in the communities. What options are there? I mean, what is workable? Is it the shift system that some schools are beginning to implement?
Well, the options available will definitely depend on the outcome of discussion with the community members, which was evidently missing in our case. In other countries, they started school reopening by having discussion with the PTAs on whether to run shift system or whether to run parallel system by looking for spaces in the community and then running parallel classes so that they don't have to do morning and afternoon. So what is normally decided by the community, taking into consideration the resources at the school, is what is used. Because at the end of the day, the parent has to dispatch the child to school and must have the confidence that the school is safe before they will do so. So that is why we have recommended that the bottom-up approach in planning reopening, I mean, in implementing reopening plans, not planning per se, but implementing reopening plans is a way to go for African governments. Recognize that one of the biggest issues on the continent is the availability of desks. So even if you split the classes into 2, you will still have challenges with desks. In Ghana, for instance, in Accra, averagely, we are doing between 2 and 3 people on a desk in Accra. And so, in the rural areas too, the situation is not different. 3 on a desk. So it means that if you have to do physical distancing, you end up having to split the class into 3, not 2, because per WHO Ghana Health Service regulations, it has to be 1 on a desk if you are using the 1 meter distancing. All this can be resolved when there's a community level discussion on the issue, and community members, through their PTAs, are able to support by providing extra chairs and extra spaces. And so we have encouraged African governments to adapt a community-led implementation of reopening plans, so that the resources of the state, which obviously are limited, would have been complemented by local community participation and their resources.
And then, the last recommendation, and that's where we have to end this conversation. Interestingly, you're asking government to give timelines for securing vaccines for frontline workers, teachers and healthcare workers, and then all learners.
We are very, very late on this, to be honest. In Europe and America and all those other advanced countries, and even in some parts of Africa, their governments have already announced timelines for receipt and then administration of vaccines. Okay, in Nigeria, for instance, they were expecting their vaccines by end of January. It just moved to February. In South Africa, there are timelines in February, they're expecting their vaccines. What I want to say is that as we reopen schools in this pandemic, one of the frontline workers are teachers. And so announcing vaccine plans and then giving timelines only goes to, among others, motivate teachers to manage teaching within this pandemic and manage the risks that they put their lives in, with the expectation that very soon they will be getting vaccines. And so, yes, government should announce their plans to administer vaccines to frontline workers, especially teachers, especially health workers and teachers, as part of motivating them, to own up to their responsibilities even before the vaccines arrive.
Well, it's just week 2 since schools reopened, and then, of course, with the surge in the COVID-19 cases that we're recording, I guess we will be talking a lot more in the coming days. But for today, I thank you so much for your time.
Pleasure.
Kofi Asari, he's Executive Director of Africa Watch. And of course, we've been looking at the situation with adherence of COVID-19 protocol. Africa Education Watch, I beg your pardon. That's where Kofi Asari is Executive Director. And we've been talking about the adherence to COVID protocols. Listen, don't let any policeman, don't behave like a toddler. Sometimes they have to be threatened. You have to mention that you are calling the police before they do the right thing. You're an adult. You've seen the figures. The numbers go up every day. And you're not insulated. I mean, you can joke about it, you can laugh about it, but this is real. You've got to protect yourself. You don't need anybody. Just look on your screen and you have to do the right. You have to protect the next person, and the next person will have to protect you. You don't need police to be on you for you to do the right thing, especially when it has to do with your health. Be responsible and take the needed precautions. So that's the end of our conversation, at least on this. We will be spending the rest of our time talking about the man, Jerry John Rawlings, and looking at what is happening today in terms of the national activities leading to the final burial rites of the late former president, Jerry John Rawlings, at the Accra International Conference Center today. He's been laid in state, and there is a schedule which I'm just going to run you through so you don't just wake up and go, depending on who you are, where you fall in terms of the lineup, then you could go at a certain time. So today and tomorrow he will be laid in state. And on Wednesday, he will be buried. Okay, so I'll come back. Okay, no, I can share with you what's happening today in terms of those expected to file pass as he's laid in state between 8 a.m. and 8:30, heads of security agencies. So I guess that should be wrapping up. 8:30 to 9 a.m., leaders of political parties. 9 a.m. to 10 a.m., we'll have the National Democratic Congress. 10 and 11, staff from the office of the President Rawlings. 11 and 12, traditional and religious leaders. And the general public, you and I, citizens, we can go from 12 noon to 6 p.m. today. 12 noon to 6 p.m., unless you're part of the special category that I mentioned earlier. We will have a little celebration of the man who we're told by the people who knew him, they say when he came around, he got involved. So we'll be celebrating him here on our show. But I've got a special birthday dedication. It's a man that we engage also here on our show. He talks about national issues, particularly on corruption. Edem Senano, co-chair Citizens Movements Against Corruption Ghana. It's your birthday today. A happy, happy birthday to you. From all of us at JoyNews, of course, the multimedia group, to you, Edem Senanu, of Citizens Movement Against Corruption Ghana. A happy, happy birthday to you. All right, stay with us. I'll see you in a little bit.